Today is 6th of January 2022. This is a 9 years old male red ear slider, 850 grams, body weight.
Now this, do you have a measuring tape? Now this slider is actually not not growing very well because the length of the shell should be longer than this. This another 3 inches longer for a 9-year-old, but some of them are quite small size. What's the length here? From the neck to the back, I think less than 9
centimeters. 19 centimeters.
19, okay, 19 centimeters. This side probably 15.
17.
Okay, so now what's the main complaint? The main complaint is here, right? Okay, now the main complaint is a lump which can be felt here actually. The fold, the neck fold, this is the neck fold. Now it's here actually, you can see the lump, focus it, and it's about 8 millimeter times 8. Before that there was a wound, is it? Was there any wound? Before that there was a small lump.
Pea-sized lump become 8 millimeters.
No, before that it was a small lump, is it? Under the skin?
I can feel that the lump is from a pea size developed into this big size.
But it was under the skin, right?
Yeah, it's like a sand grain, 4 or 5 times of a sand grain. Then gradually within days it developed into big lump.
Now it could be some growth, or it could be
I press on
a
it.
cyst. Now, so appetite has gone down, right?
Yes, correct.
How long already? Eating very little, 1 month, right?
Yeah, 1 month.
And passing through, little, very little, right?
Yeah,
1 month also, right? Okay. Now I just put it upside down, see whether it's active or not. Now normal ones, they would go upright within 1 minute. But I doubt this one is active. It has stopped eating, lost appetite, right?
Yes,
1 month. So other than that, any diarrhea?
Don't have
No diarrhea, right?
no.
Now this is a male. You can tell that this is a male by the claws, the red ear slider. The male ones have long claws. So there's one way of telling it's a male. Now what do you want to ask him about the shell? No,
I
what?
think there is a bit of shell rock. I think I apply some medication.
Yeah, should be okay.
So
It's not that bad. Now, according to the owner, there was a neck abscess in 2017, and I think it was lungs, and then the abscess came out. So now you can see, actually this is interesting. You can see the scar. The color is different here. So that's a scar, but it recovered already. So there's no pain here.
treated by you all.
This about 5 years ago. So now, what is the treatment? Now the treatment is under anesthesia, and do a small cut and go in and see whether can remove it. Now there's a danger of the blood vessels and the nerves around the neck. Other than that, the anesthetic also is dangerous, as this red ear slider has not been eating for 1 month, not eating well. What happened to the eyes?
Swollen. He has been
Now?
closing the eyes for the past 1 month.
Is it okay already?
When I instill with eye drop, at times it will open. But somehow, I don't know, is it due to the lungs or there's some eye problem that
No,
he will close the eye
It's a lump.
at times. Then he will use his inner eye to peek at the surrounding.
Now the best time to operate is when the appetite has returned. So what I'll do is, we will syringe feed it first and give antibiotics and anti-inflammatory. See whether it can bring down the swelling or not. If it doesn't matter, but if I operate today, chances are you may die, you see. So it's better not to rush into it. So what do you think? because you rush into it, it just die after 1 or 2 days later, and that's the end of the life, you see. So the best is we syringe feed it, make it stronger first. Is it okay?
But I think due to the lung, he is not eating already.
Correct,
because
correct.
I think the pain is obstructing him from eating.
Correct, but then this painkiller might bring down the swelling, you see. No, it
Usually he can still eat, but I think the lung might obstruct him from eating.
no, the lump obstructs him from the neck going in, but
Yeah, that's why
it's not affected. It doesn't affect
Yeah.
the flow of the food. No,
Sort of is uncomfortable. That's
uncomfortable.
why he don't want to
It
eat.
just can turn over. Okay, this one is best not to rush into it, because if you rush into it, since you delayed so long already, and I will give the painkiller and the injection as well. Then you will see whether the swelling goes down. If it goes down, there's no need to operate already, because we don't know what is it actually. It might not be a tumor. It might be a cyst or some irritation.
Cyst.
The best is don't rush into surgery. I mean, there's no point if you rush into it and 2 days later it dies. Infection, bleeding, there might be a blood vessel swelling. We call it the hematoma. So really, just like that, you can't tell. Is it? It's not very hard. It's not very soft. So you agree or not? So we just observe.
I'll review in how long time?
7 days
7 days.
is the best. Even operate also, I have a feeling it might go down the swelling.
You got operate.
With anti-inflammatory.
7 days time.
No, of course you got to feed, make it stronger first.
Oh.
Okay, Sue. Okay.